In the small town of Lowville in New York's North Country, women will soon have to go up to 50 miles away to give birth after 42 healthcare workers resigned over the state's vaccine mandate, and another 120 have still not complied.
At the end of business on the 27th, if you are not vaccinated, unfortunately, you can't work here anymore.
Already faced with a staffing shortage, the hospital is pausing its maternity services after next week and reevaluating other departments.
What does that tell you about vaccine mandates?
It works. We went from 63% in mid-August when the mandate was first announced. And now, about 4 weeks later, we are at 81%.
Nationally, COVID cases have finally started to dip, although hotspots like West Virginia and Kentucky are still rising. Today, the American Academy of Pediatrics warning cases in kids have increased exponentially. New data shows children accounted for nearly 30% of all new cases last week, though only a fraction of those led to hospitalizations. There are battle lines being drawn across the country. In Union County, North Carolina, where there is no mask mandate, the school board voted to halt contact tracing and most quarantine procedures.
The mall has a mask mandate, so I feel safer there than at school, and it should be the other way around.
While parents are split over the best strategy to protect our kids, the FDA is warning parents to not seek unapproved shots for children under 12 who remain too young to get vaccinated, saying children are not small adults, while pointing to ongoing pediatric clinical trials. A vaccine is expected to be approved by the end of the year.
And breaking news tonight, a New York court has issued a temporary restraining order blocking enforcement of the state's hospital vaccine mandate. When somebody claims a religious exemption, the state has until the 22nd to respond.